How do we combat the growing global threat of multi-drug-resistant bacteria, especially when traditional antibiotics are losing their punch? A promising answer lies in the realm of immunomodulatory therapies. These therapies are innovative strategies that work not by directly attacking the bacteria, but by boosting the host's immune system to mount a more effective response. This approach comes with a couple of significant advantages. Firstly, there's a reduced risk of bacterial resistance because these therapies are not directly attacking the bacteria, which minimizes the selective pressure for resistance development. Secondly, they can offer broader protection, being effective against a wider range of pathogens compared to specific antibiotics. Consider the use of antibodies, for instance. These can enhance phagocytosis, activate the complement system, and neutralize bacterial toxins. A case in point is panobacumab, used against Pseudomonas aeruginosa, which promotes bacterial clearance and improves survival rates. Then there are hematopoietic growth factors like granulocyte colony stimulating factor and granulocyte macrophage colony stimulating factor, which stimulate the production of neutrophils and other immune cells. This can reduce the risk of infection and shorten the duration of hospitalization for vulnerable patients. There are also extracellular immune mediators, such as interferon gamma, which is used for clearing Mycobacterium tuberculosis and reducing symptoms. Immunomodulatory peptides are also being developed that can directly kill bacteria and stimulate host immune responses. Examples include pexiganin for foot ulcers and omeganin for catheter infections. There are even strategies that involve combining vitamin D with phenylbutyrate to inhibit the growth of multi-drug-resistant tuberculosis in macrophages and strengthen the action of antibiotics. Despite these promising developments, challenges remain. Some therapies are expensive or not widely available, which necessitates further development and improvements in accessibility. The specificity of these therapies and their potential side effects also need to be carefully managed for wider adoption. However, the future is looking bright. The integration of immunomodulatory strategies with conventional antibiotics could potentially maximize effectiveness and minimize resistance development. In conclusion, immunomodulatory therapies offer a promising avenue for overcoming the challenge of multi-drug-resistant bacteria. With continued research and development, these strategies have the potential to revolutionize the treatment of infectious diseases and save countless lives.